many days now. For the past so many days, we have been watching webinars about the coronavirus and how to handle the situation. And this will actually definitely give you a different perspective on a different opportunity that can be utilized not only to generate new revenue for you within the next 30 days, but also significant additional revenue for when this whole coronavirus nonsense is gone and away. All right, so I am going to share some slides now, and I'm going to go through the concept so you guys can understand specifically how we use this to maintain our revenue, but then in the future to really go into a different trajectory. So this is a slide that I have used several times, and some of you have seen it before. But this is a very important slide. So let me give you some facts. I am a member of the International Franchise Association. Today, they said in a webinar that I attended that they are estimating that 20% of the restaurants across the nation will not be able to reopen even after the whole coronavirus passes. So that creates then a question: what will it take for a physical therapy private practice to be here tomorrow, to be able to survive this and be able to continue? And look at this, look at the principle here. I'm gonna remove the slide for a moment so you can see me, so I can give you the principle to understand. Let's say that you are making a decision to start a brand new physical therapy practice. How do you do that? You have put some money on the side, or you get a loan, you get some funding. So when you start, you have money to move on for the first 3, 4, 5 months until you start making enough revenue and you are able to start that practice and do better. But that is not the same when you already have a practice that is established, that is bringing so much revenue. And not only it brings so much revenue, but it has a bunch of expenses also, okay? Because your current practice, no matter how small, no matter how big it is, it has some expenses. And then maybe you have some money on the side, maybe not, maybe you have some money on reserves. When you get into a situation where you come into this condition here, where you have now gone from a revenue, let's say of $100,000 a month to zero, because you closed your practice, or because nothing is working, or because you can't get a new patient in the door, or because you cannot convert fast enough to telehealth or whatever, what's going to happen then when, yeah, the government will give you now some money, but guess what? You are having, number one, expenses, and number two, that money will not be forgiven unless it is being used for something that really is meaningful, for something that can be what is called forgivable expense, right? It can be payroll, it can be rent, it can be utilities, that type of stuff. So it is possible then to have a situation where you borrow the money, and at the end of the day, the money is not enough to last to start you up on the business for the post COVID-19 times. So your recovery, if you manage to recover, will be very, very slow. So alternatively, what I've been saying is, this is not the ultimate way to do it. The ultimate way to do it is to start from a let's say $100,000. But yes, even if you have a decrease on revenue, that decrease of revenue not to be so substantial to depress significantly your recovery. So what I'm telling people is this: the smart private practice owner is going to implement a strategy where they are going to mitigate their losses by applying various various methods of mitigation. So this way, when you get the money from the PPP, from the phase 3 of package number 3 from the government, you use that money to just augment the business, a business that is producing even to some degree. The lesser loss of revenue you have right now, the better recovery you are going to have. And this is a certain thing. So this is why we are suggesting mitigation strategies. And we suggested one of the mitigation strategies is telehealth, tele-PT, but also another major mitigation strategy can be outside diagnostic business. And I am going to analyze and explain to you specifically how this is done, okay? So you create a diversification model where you are delivering a variety of diagnostic tests, which, by the way, you can have a big chunk of education of it within 30 days from the moment you start with us. And you offer these diagnostic tests not only to your existing patients, because let's say that you don't have any patients, you shut down the practice. You can still do this model, okay? But you offer these services to other physical therapists who are in your area, you call them up, and who still have patients, or to specific physicians groups that they still see patients, or other healthcare providers that are considered essential, that they offer essential medical services and they are still open. And you are able to obtain, in terms of revenue, $300 or more per hour delivering these services, okay? Not that bad for a COVID-19 period, right? And of course, there are other benefits, but I'm gonna explain to you exactly how this model works, okay? And of course, I'm talking about the model offered by HandsOn Diagnostics. I am the founder of HandsOn Diagnostics, and I have with me on the call Dr. Rizopoulos, who is the co-founder and the president of the business. And we have also another partner, Craig Ferreira, who is the CEO of the business. All right, so, but let me explain to you how this works. In a normal environment, in a normal capacity, we say that we are able to implement diagnostic testing right into the treatment plan. Just as you are forming the treatment plan, we are implementing diagnostic testing so that you are able to get better clinical outcomes and better patient experience, okay? And this is what we have been doing all along for many years. But right now, we're changing a little bit the model, and we're giving emphasis in it, and we're creating a model so that we can give you an immediate cash injection into your practice with a minimum layout of cash right now. Okay, so in terms of tests that are provided, what you are going to learn within a year span is EMG, nerve conduction studies, musculoskeletal ultrasound, and neuro ultrasound. However, what I'm talking about here is that you are able to actually deliver these studies, not after a year. You'll be able to deliver at least some of these studies within the first 30 days that you are going to be in the program, and a lot more of these studies within the first 60 days that you're going to be in the program. And think about this, right? Even if it takes you 30 days from the moment you start the program to deliver services and start getting influx of cash, think about this. You're going to get right now some money from the PPP, right? This money is going to last for 30 days, for 60 days, okay? But what happens after 60 days? You have to have the ability to continue making revenue from something, okay? And if that something is not going to be the tremendous influx of new patients, at least if you have the ability to make money from services that you are already delivering, that you are already having within your practice, that offer you reimbursements 3 to 8 times greater than what you're getting right now, then that is a very big opportunity. An opportunity that APTA has realized and advocated, and they are fully supporting all PTs who perform diagnostic testing. All right, so there are 4 revenue streams that you are going to be able to create, okay? So let me explain those to you. Let's suppose that right now you are still open, okay? Let's say you had, I don't know, I'm going to throw some numbers out. Let's say you had 400 patients a week, 500 patients a week, and now all of a sudden you get to see maybe 150 appointments, okay? So the first revenue source is that you are able to deliver these diagnostic tests for your own patients in your own practice, build the insurance company, and get reimbursed. You, as a physical therapist, get reimbursed for EMGs and ultrasounds, which are the first 2 things we are going to teach you, EMGs and ultrasound. Okay, so you'll be able to get paid for that, and starting 30 days, perhaps to 60 days for some of the tests. All right, now, but hear me out. This is the second revenue stream, and very, very important. What you're going to do, guys, is this. The moment you buy into our concept, we automatically make you an exclusive partner in that area. So we decide together on a specific territory of exclusivity for you. This means that if your competitor next door or a block away or 2 miles or 5 miles or 10 miles away, when your competitor gives us a call and say, hey, hi, we saw your webinar, we want to join HODS, we want to get into diagnostics, guess what? We cannot and we will not accept that individual, that competitor of yours as a client of ours for training, because you have an exclusivity with us. You buy from us a territory of exclusivity, okay? But you can go to that competitor, you call them up, yeah, do you see patients? Yes, I am seeing some patients, maybe 30% of I used to see. Well, how would you like to make some additional revenue from your existing patients, Joe? Oh, that would be a great idea. How can I do that? Well, here is how we're going to do that. I will come to your office and I will deliver diagnostic testing to your patients, EMGs and ultrasound, and we will have a revenue share. Okay, so this is how you do it. And you do exactly the same thing with physicians' offices. And I have a list of various physicians. But let me ask you this question, okay? So right now, when you are not so busy because patients have fled, they are staying in their homes, they are not going out because to take care of their back and their shoulder problems. Is their back and shoulder problem a life-threatening problem? I don't think so. Maybe it threatens the quality of life, but it is not a life-threatening problem. But how about when they have heart disease, hypertension, diabetes? Are those life-threatening problems? Yes, they are. Do they go to their primary care physician to take care of these problems? Yes. The primary care physicians, they're still open. They see patients. The endocrinology doctors, they are still open. They see the diabetic patients. Well, these are the doctors that we help you to make arrangements, agreements with them, where you go and you deliver these diagnostic testing services in their offices, and these physicians are able to then build the insurance company, get money from the insurance company, and they pay you a negotiated fee, a fee for service for those testing services they got. Of course, and here is the graphic, it shows that, and that's how you get paid. And of course, now you are in a physician's office, you are delivering these services to those patients. Well, where are these patients going to be referred to physical therapy or to telehealth physical therapy, to tele-PT? Well, they're going to be referred to your clinic or to your tele-PT service. And of course, that's additional revenue for you for offering tele-PT or telehealth services to those new patients that come to you from physicians' offices. And of course, you have direct access. We have an entire marketing campaign that we are running that we are marketing your facilities. As a matter of fact, if you go, after we finish this, to www.findbestpt.com, you are going to see a whole bunch of facilities who are our associates, our partners around the country in 26 different states that we promote and we send patients to them. All right. So now, in terms of the training process is very handheld. There are online modules, and even we have implemented now, instead of live modules, we run a live module in our location, and that live module, we are also offering it as a live online. What is live online? Live online is that you are having a partner in front of you where you are going to do the testing procedures. You are wearing your fancy Google glasses, and the professor in the class sees exactly what you see. The professor in the class sees your computer screen, your equipment, sees the patient, the subject that you have in front of you, and can lead you through to training, even in a live online remote training capacity. And of course, we have mentors. The mentors can fly directly into your location and provide you with the training and the mentorships that we are offering. Our program is based very heavily on mentorships, okay, on mentoring you. And we have, of course, weekly online sessions, symposiums, a lot of different things that we offer you to increase your education. We are really a community of physical therapists that we have as a goal. Everybody who is associated with us, they are really the next generation PTs, the entrepreneurs, these who are the forward thinkers, these people who are really looking for a different future and can really envision a different future for them and their practices, okay? Because let me tell you, I've always been saying, and Kostas, my business partner, has been saying that, well, physical therapy is evolving very fast, especially after 2020. Physical therapy is evolving at a tremendous pace. But let me tell you this, After this, after COVID-19, physical therapy will have to evolve in a much faster speed than ever before to properly deliver services, to become accustomed to a totally new environment and totally new requirements of the society. So there are some very unique opportunities that we have in front of us here. Let me see. Yeah, as I said, there are a lot of mentors that mentor you in everything. They mentor you in the EMGs. You have your own mentor for ultrasound. You have a business mentor. You have a billing consultant. I mean, we are fully support you and your operation because we succeed when you succeed. So I just want to show you, when you call, let's say, one of your colleagues to go and do testing in their business, this is the type of patients you're looking for. Now tell me, I mean, what percentage of your own patients have these symptoms? These are candidates for EMG and neuro MSK. Think about this. How about this for ultrasound? These are the indications and diagnosis for ultrasound. How many of your patients have these symptoms? In a physical therapy place, it's a no-brainer. We have this type of patients. The majority of our patients are this type of patients. Unless you tell me that you have a pediatric practice only, that's a different story. And these are type of physicians that you are really approaching for the outside business, especially these internal medicine, family medicine doctors, and so on and so forth. Okay, so I have some numbers for you guys. I want to show you some actual numbers, but I want to get a quick idea about something from you. So I'm going to open up a quick poll, and please just answer these questions. If you are a private practice owner, if you had staff to let go, and what is the percentage of the negative effect that COVID-19 had in your practice? Just go ahead and vote real quick so I can get a sense of where we're at with everybody. I'm going to give you a couple of more seconds. Okay, so let me end this. Let me show it to you. So most of you are private practice owners. We have a few people who are not private practice owners. Those of you who are not private practice owners, you can still talk to us about this model that I am talking about, because we have a way that we can deliver it to you even if you are working for a private practice or for a hospital or for another organization. So if you are not a private practice owner, we still have a method where we can involve you on this. And that's great that most of you did not have staff, you did not have to let go of staff, so that's awesome. And the negative effects, it's a mixed picture. The vast majority, unfortunately, had more than 60% of negative effects of the practice. And unfortunately, that is the reality of what we've got. But I have, as I promised, I have some numbers for you, okay? I want to show you some numbers. Unless, Kostas, you want to say anything before I share some numbers.
I mean, what I want to share with you guys is that, yes, I totally understand that everybody's going through these very interesting moments, and all of us try to calculate the change and how big of a change, and whether we're ready for the change, and whether we're old enough for that change or too old for that change. You know, it's funny, I'm 55 years old, and I was, when the whole thing started, I'm like, I cannot start again. You know, it feels like all over from the beginning. But you know what? This is the time that you have, you know, of course you have the choice to stop and do nothing, but we are physical therapists, and physical therapists, they have an ability to fathom, to find out ways of creating things and create exercises and make the patient feel better and change programs and change treatment plans. So we know what change is. We live with change all the time, and we cause change to others. So it is not very hard for us to really come up with a solution to our problems. And no matter what, we have one. It's a matter of time. What my business partner, Dr. Kostopoulos, is giving you guys, it's an idea, it's a concept that we believe is going to be very, very helpful going forward in this crisis.
Yeah, exactly. And I would like actually to show you guys, thank you, Costa, some actual numbers in regards to how this would work and the type of impact that this can have in your practice. Okay, so bear with me. If it gets confusing with the numbers, just bear with me. It will make sense at the end. Okay, so let's look at that. Let's suppose that you have a practice that has 20 new patients, okay? 20 new patients a week, all right? You can say 20 new patients a month, it doesn't matter, okay? And let's say that those 20 new patients are producing 300 appointments, 300 appointments a week or 300 appointments a month, it doesn't matter. I am going to use that your reimbursement for those visits is $97 a visit, which is the national average, last year's national average as per the P2P, the peer-to-peer group of PPS-APTA. That will produce an income of $29,100 per week or per month or whatever, right? Let's say that right now you have lost 50% of those patients, okay? And you are getting then half of this money. You are having a net loss of $14,550, okay? And you are making $14,550 per week or per month, whatever that is, because you lost half of the patients. Now, here is what will happen if you add diagnostics. And I am not even telling you to apply diagnostics to all patients. I'm not even saying that. I'm taking a small sample of 5 patients. In those 5 patients, you applied EMG and neuro ultrasound, you applied the joint ultrasound, you applied the evoked potentials. So from your in-house business, from the business from within your office, in this scenario, you could potentially have $8,000 of additional revenue without doing any marketing, without getting new patients, just from those patients that you have left right now in your facility. So if you had a loss from your PT of a loss of 14,000, let's say $500, all right, this was the loss you had. So right now, if you get $8,000 from diagnostics, you decreased already the loss significantly down to $6,500, all right? But that's not all. That's not the only thing I'm saying. Here is what I'm saying. I'm saying you will go and do outside diagnostic business to other physical therapy offices, to physicians' offices, to podiatrists, to chiropractors, to name it. That will yield for you approximately $300 per hour. If you or a staff member did that 3 days a week at $300 per hour, that would yield for you another $7,200 per week, which means then that if I put together the $8,000 you made from the in-house diagnostics and the $7,200 you made from the outside diagnostic business, essentially you're not gonna lose any money or even be a little ahead than what you were before COVID-19. Okay, this is a scenario. This is a hypothetical scenario. I'm not promising this to you, and I'm not telling you that this is exactly what will happen. But what I'm telling you is that there is a potential for you to really not wait, doing nothing, or doing only one thing, or doing only telemedicine, only telehealth as a solution. You have to have multiple solutions, okay? You're already realizing, if you started telehealth, you're already realizing some issues there too. Not every patient is comfortable on telehealth. Not every single person wants to do it. There are some challenges in that area too. So if you look at this as a single pronged approach, okay, what I'm doing is I'm cutting my expenses. How much are you going to cut your expenses? You cannot cut the expenses totally to zero unless you stop existing. You will always have some expenses. So yes, cut expenses, but without looking at additional mitigation strategies, cutting only expenses is not really a good solution. The same way, think about this. There are several people in economics and financial advisors. They are telling you that you must have 3 to 5 sources of income in the good days, right? Now, same way. Think the same way. You have to have 3 to 5 mitigation strategies. One mitigation strategy is cutting expenses. Yes. A second mitigation strategy is getting the loan and trying to forgive as much as possible. A third mitigation strategy is getting telehealth. A fourth mitigation strategy is getting into and applying diagnostics. And you gotta find another one, a fifth one too. But there is even more power. Oh, and the fifth one was still keep the office open and still keep seeing patients if you can, as many as possible live. So those are the 5 mitigation strategies. We are doing, by the way, all 5. We are implementing all 5 mitigation strategies. Okay, so here is the idea though. There's a very big difference. Cutting expenses is one thing. Getting the loan is also important. But neither cutting expenses nor getting a loan causes production. None of these two create production. Seeing patients in your existing office, it's production. Doing telehealth is production. Doing diagnostics and investing in it, it is production. So that makes a big difference. Getting production makes a big difference because you rely on production, not only now, but also in the post-COVID-19 time, to really bring the practice to the next level and grow the practice. Without production, no matter how many loans you are gonna get, no matter how much you'll be forgiven, you really need new production. And when you have something that without needing to get any other patients in, you don't need additional marketing for this. You use your existing patient database just to do the testing for them. That brings you significant additional revenue. That's all you do. And now let me tell you, I've done these webinars in the past discussing about HODS many times, right? I've done 100 webinars in the past over the years, but there is some breaking news, something really very important at this point in time, and a very unique opportunity for you. So let me tell you what the opportunity is. Yes, I understand if you never looked at HODS before and what I'm saying is all news to you, that's fine. I mean, yeah, let's talk about that. But if you had in the past an eye on HODS, and for X, Y, Z reason, you were reluctant in getting into HODS, well, guess what? This is the time. Why? Because at this very moment, HODS, the board of HODS, in order to help all of you do something for your practices, we have created a very unique opportunity to bring on practices just with a $5,000 down payment and a long payment plan that we will work with you. But essentially, with $5,000, you can get into HODS, you can get training, and you can start creating that. I mean, I can tell you $5,000, you are gonna make it after very few tests that you will do, especially when you consider that an EMG with neuro ultrasound has a national reimbursement of $700, and an ultrasound has a national reimbursement of $175 or $200, okay? So this is a very unique opportunity to get into HODS, especially if you always wanted to get into HODS at this very time. We have also people who are watching us from Facebook Live. That is awesome. You guys can post your questions on Facebook Live also. I'll be happy to answer them. Let me go back to here. And I will open okay, the question is, what is the total cost including the $5,000 down? Hold on a second, I'll talk about that. But I have in the sequence of things I'm showing, I have a slide with a little video which I would like to play. As soon as I play it, I will just answer the questions, okay? So here we go.
Because you're a physical therapist, you're not afraid to face pain. Where many see obstacles, you see opportunities. Because you're a physical therapist, you're always looking for solutions to your patient's pain, dysfunction, or disability. Looking at the surface of a problem will never be good enough for you. You're poised to tackle your patient's problems using every molecule of your body and every modern tool available to heal them. Because you're a physical therapist, you're a scientist and a pioneer. You are willing to step beyond the crowd and lead the way. You dare to dream the future of the profession. A future where advanced diagnostic technologies of ultrasound imaging and electromyography are at your fingertips. Hands-On Diagnostics helps you see your patient's pain. Together, we can create your future of physical therapy now. It's time for diagnostics in physical therapy. Seeing is believing. Join the movement now.
All right, so let me just, I need to adjust something here, and I am going to answer questions. How do I change this? 1 second. 1 second. I need to do this and change it here. Okay, good. So first of all, also let me show you here as I'm answering your question.
Because you're a physical...
There. Here. So let me answer your question as I'm showing this slide. Okay, so your question was how much is the total price to be a partner on HODS? So it depends, okay? And the reason I'm saying it depends is because it depends on the location of your office, on the zip code, and the territory of exclusivity that you will get, okay? It varies on that, and it varies also on if you want to train one staff member or 2 or 3 or 4, okay? So there is a variation to that. So the way we do that is you go to hodsmeeting.com, you book something, we call it a discovery call. It doesn't take that long. It's half an hour. And during that discovery call, we just get some numbers from you. We get, where is your practice? What is your zip code? How many staff members you have? How many we are gonna train? What is we're looking at the demographics of your territory, and we discuss with you what would be a proper territory of exclusivity for you to have. And based on that, you are gonna see there is a formula which you are gonna see the formula, how it calculates the total amount. But here is the point I'm making. Right now, guys, you can get into HODS just with a down payment of $5,000, which we have never, ever done that. Usually people pay the entire amount up front, okay? That's what usually happens. But in this situation, because of the circumstances we have right now, as a nation, we are making this offer, allowing you to gain access to testing and start making the money before you even start paying the rest of the money to us, to start making money, which is very, very important. Let me see. Okay, so here is my information, which you already have it. That's my cell phone also. But I'm gonna stop share for a moment, and I'm going to go back here, and anybody who has a question, please ask your questions. You can raise the hand so I can unmute you, or you can ask a question by typing it, and I'll be happy to answer it. So any questions from anyone? Okay, let's see. Okay, I looked into this after summit in 2020 in Texas. After we met, can you provide literature that this is a covered service by CMS? Yes, of course. What you can do, Charles, is please email, go here and schedule a meeting with Bob at hodsmeeting.com, or email to Bob at bob@ihods.com, and he will be able to provide to you exactly the CMS regulations. Let me answer then Cindy's. But before Cindy's question, there is another question that says, please advise on the cost of the ultrasound and EMG equipment. Okay, ultrasound equipment at this point, there are so many different options. You can literally get ultrasound equipment that can cost $15,000, $20,000, $25,000, $30,000, or you can even rent a subscription model with $200 a month. So you have a lot of different options in ultrasound equipment, okay? In terms of EMG equipment, it's gonna cost you on a finance just $400, $450 a month. That's gonna be your cost on the EMG equipment to finance it. Okay, what Cindy's saying. I seem to remember that when I last looked at HODS, I had difficulty finding about reimbursement in my state. Can you assist me with information, that actual reimbursement information? Cindy, really the very best thing for you to do is schedule one of these discovery calls and do two things, because we can kill two birds with one stone. Just provide your zip code so we can be able to give you like what would be the total amount for you to get into HODS. Of course, as I said, the down payment will be $5,000, but at the same call, you're gonna tell us, this is the information I need, 1, 2, 3, 4, and then we'll get everything to you. So we handle all this at once. Can you share the slides for this webinar? They say thanks. And of course, I can share the slides for this webinar, and that would be my pleasure to do. And let me see if I can even do it rather fast for you as we are delving into any other question. There was a question, are physical therapists licensed in New York to do EMGs and musculoskeletal ultrasounds? The musculoskeletal ultrasounds in New Jersey, yes, you can absolutely do them. There is a specific provision in New Jersey that does not independently allow you to do needle EMG. New Jersey, unfortunately, is one of the very few states that we have, I think, in the whole nation, 2 states or 3 states that don't allow that. And unfortunately, New Jersey is one of them. And yeah, we don't like that, but this is the reality with New Jersey. Let me see if I can share with all of you. Okay, I don't see how I can share with you right now the handout. However, what I will absolutely do is I will email to all of you who attend this the handout. Those of you who are on Facebook, please email to me directly in this email address at dimi@handsonpt.org. Yeah, I can't even show this here now. You can email to me at handsonpt.org, dimi@handsonpt.org, and I'll be able to send you the PowerPoint presentation for this with no problem. So this is the email to contact me. All right, any other questions from anyone? Let me see. Are there any other questions? Questions and answers. Let me see. What is, can you speak to Pennsylvania for EMG and ultrasound? Yes, Pennsylvania is all thumbs up. We already have people, several people in Pennsylvania who are HODS partners. We have several of them, including Daniel Neff in Pennsylvania, along with others, but Daniel Neff is one. You know, Dan, who does the manual therapy, partner of Chad Madden, he is with us. What is the timeline for studying the courses? Okay, here is very important, and I'm gonna finish in 5 minutes because in another 5 minutes, we have a major meeting with our HODS franchisees. So the information about time of study, yes, all approved in Florida. We are in Florida already in several locations, so all good in Florida. So when it comes to ultrasound, after you take a 3-day course, okay, which can be either live or live online, you'll be able to start delivering the next day the musculoskeletal ultrasounds, okay? You're going to do the upper extremity, let's say, or the lower extremity, and then you'll start delivering right away. Then you're going to do the other part of the body, and you'll start delivering for the other part of the body. Okay, so the delivery is immediate for that. When it comes to EMG, it is a little different. You're going to take the first 3-day module, live or online, and what happens immediately after that, you will have to do some normal people, like some friends, some co-workers. You need to do some practice. And a couple of weeks later, you take the second module of EMG. Once you finish the second module of EMG, then you can start doing patients also. And it is approved in Florida. I said that. Okay, good. Any other questions? All right, very good. So as I said, you can go to hodsmeeting.com to make an appointment. do me a favor. Can you privately put on the chat message for me if you have scheduled already or you are planning to schedule a meeting with our at HODSmeeting.com. Let me see. Texas, yes, Texas is on. Okay. Yeah, you should speak to Bob again, because when you spoke to him, the answers he had for you were based on the pre-coronavirus environment. Now he can advise you for different things. And Kansas, we're on. Yeah, of course we're. Yes. Good. Fantastic. So I hope you guys are going to capitalize in this very unique opportunity that you have to, that you can join HODS right now, and you can do it. We have Mimi Marcelou, our very good friend from Greece. She's attending right now, and she is talking to us about that. And Mimi, just contact us directly. Yes, there are opportunities and possibilities to do this in Greece. It is not under HODS. It will be done under the American Academy of Musculoskeletal Ultrasound. And through this organization, we can work and deliver this product to you even in Greece and anywhere around the world. Okay, how long will you keep this offer open to us? Look, here is what my suggestion is. Establish a communication with Bob at HODSmeeting.com. At least Bob knows that, or I know, send me an email that, yes, I'm interested to do this. And as long as we know that you are interested, then we'll work with you on the timing. The reason I'm doing this webinar right now is because there is a very, very unique opportunity in the month of April for you guys to start. We have already scheduled an EMG startup course and an ultrasound startup course in the month of April, which means that you guys can get delivery of that course even live online. You can get the course done even live online without even doing it in one facility. So you can start this, and if you do it in, if you take the course on April 24, 25, 26, literally on April 27, you can start delivering the ultrasounds to your patients. You follow me? So it can be that immediate, and you can start recruiting revenue, making revenue. That's why I had the urgency to do this delivery of this webinar like quickly, to let people know about this April training. Okay, thank you all so much for attending. And again, contact us directly or go to HODSmeeting.com and contact us there with any questions you have. All right, thank you all. Have a good night.